As Budget 2023 increases health operating expenses by $965 million in Alberta, that's an increase of 4.1%. The opposition NDP fearing it doesn't account for inflation.
In terms of investing, they are $1.4 billion below simply keeping track of population and inflation growth. And this is in the midst of a healthcare crisis now. The Minister of Health and the Premier are denying.
But for those on the front line, they want the public to know there are still real issues in the healthcare system that many say is still in crisis.
The morale is very, very low. And I think all of us on the front lines know. And we know that there's not going to be a quick solution.
Dr. Nija Bashki wakes up every day to check hospital capacity. The internal medicine physician at the Royal Alexandra in North Edmonton finding daily the hospital is over capacity. Edmonton has not seen a new hospital built since the 1980s, even with a population that has nearly doubled. That's part of the reason Dr. Bakshi is pushing back against comments made by the Alberta Health Services administrator Monday.
When I started at Alberta Health Services in November, I was told that this was a system in crisis and a broken organization, and I didn't really know what to expect. I am here today, however, to tell you that AHS is not in crisis and is not broken.
You know, to say that the healthcare crisis is improving or things are changing is a statement that can't be made if you haven't addressed the primary care situation.
The internal medicine doctor cautioning against only looking at surgery wait times or ambulance response times. While important, those benchmarks miss huge pressure points in other parts of the healthcare ecosystem. Take family doctors.
Even if we were to say that the hospital situation has dramatically improved and we've improved flow, which we have not, I still have to discharge that patient, and that patient needs a primary care physician to help them stay out of hospital.
Well, Cowell no longer believes we are in a crisis. He does agree there is more work to bring up quality of care.
We remain very aware that COVID challenge is not gone. It still remains with us, as the other infectious diseases are. And there is still a lot more to be done.
Medical professionals also raising concerns about lab capacity, long-term care and staffing. Budget 2023 includes mention of long-term care and staffing, along with a continued focus on emergency care and mental health. In Edmonton, Carly Robinson, City News.